information and a source of inspiration and a source of knowledge that we've now been able to identify in the McLean Hospital of the Harvard Medical School. Here is Adriana, who has helped us put it all together.
Good afternoon. So I know we're running short on time, so I really just wanted to thank Mr. Padashi and also Shane for being here, because it's voices like yours that help us get out these messages, because without you, the press wouldn't be here. And now, I'm well aware of that. But it's clearly a very important message that we're all trying to deliver, and as a team, both the McLean Hospital, Harvard Medical School, the NS Vihia Foundation, the government, and the Rajasthan Royals are coming together to really put out this information about, and the Neuroscience Center, of course, the information about brain health and mental health awareness. And I'm sure if I asked everybody in this room to think about whether or not you have an experience with anxiety or feeling stress, or somebody in your life feels that way, if I asked you to raise your hand and admit to it, you probably would think twice about it. And what we're really trying to do is get to a point where it's okay to raise your hand and say, yes, I have anxiety, or my brother has bipolar disorder, because there's really no shame in any of that. And so we really do hope that after this conference, you'll come down and take a look at some of the work that we've done, because it's not just about holding the brain. That's how we also lure you in. But it's about real people's stories. We have people from India who talk about the suicide of their mother, and the fact that mom lived with depression and was too embarrassed to ask for help. And that's a sad thing. We don't have to experience that any longer. So by the work of the Vihia Foundation, McLean, the government, the Royals, and the Neuroscience Center, I think we're taking a big step in reducing that stigma and hopefully helping a lot of people in India. And Shane, just let us know when we're coming to Australia.
Yeah, done. No problem. Thank you very much.
Professor Kenneth.
It's an honor for the Neuroscience Center to be partnering with the NS Vihia Foundation and the McLean. The primary objective with which the Science Center was actually the series of Science Centers, network of Science Centers were formed, is to create scientific awareness. Enhance the understanding of science is one thing among the students in particular, but creating scientific temper is something which was very unique. To give you one example, that in India, when we had this solar eclipse, there was a time when no one used to walk on the roads. After creating the awareness, people like one of the great scientists were involved in this, Professor Ishpal, for example. He went live to explain what the total solar eclipse is all about. Now, if you really go and see in any part of the country, you will have people wanting to see the eclipses. In a similar manner, I'm sure it's not going to be many years from now that mental awareness is going to be talked about. That the stigma that has been attached to this, it's aptly named as destigmatizing mental illness, is something which I'm sure is going to be achieved. And the government is doing a great thing. There is a national mental health survey that has been done prominently, which was, I think, piloted by NIMHANS. So I'm sure all these efforts and the efforts of NS Vihia Foundation, this is not the first one. I think we are the third partnership that we are doing with all these things, and the number of people who come to our Science Center, which is about 800,000 annually, with lots and lots of people coming in. The message will go out, and brand ambassadors like Shane Warne and Sir, your presence, I'm sure it will accentuate the awareness. Thank you.
One single person who helped me, to encourage me to hold this event, Mr. Ranjit Thakur.
I'm also respond to Sir.
What?
Yes, I was going to say, no one else knows the tragedy. They should also.
Normally I have the last word except at home. So
This is a good time to actually
the last word. I
think maybe my involvement.
Sir, I think.
Yeah. Oh, sorry. My involvement with this entire initiative of mental health really stems from my lack of awareness of this. And when I got to understand from Vyang and his son in later years, that I just thought that something had to be done, because I don't know of any other challenge that a human being has which is growing at such a fast rate. This is coupled with the fantastic healthcare we've done globally and in India, where longevity has gone up. You know, in 40 years, people have gone up from roughly 45 years to roughly 70 years, meaning that's what the longevity has gone up. And with longevity, what comes is this challenge of mental health, because you don't really know, we're not catered to people sort of living to 90 and 100, and really the challenge and what we do now is really for our own future. So selfishly, I think about myself, and I'm just wondering, what should I do, meaning when I'm 80 and 90, because I don't think we understand what's happening at 40 and 50, let alone what's happening at 80 and 90. So I think this initiative, and many other initiatives, but this one in particular, is really amazing. I did have a tryst with the Harvard Medical School many years ago. I think I was younger then, and for over 2 years I had a real going and coming with them to set up affordable and available healthcare for Asia and Asia Pac. And I think it's really sort of a deja vu for me when I saw McLean's and NSIR coming here. The Harvard Medical was only just an affiliate. Now I understand that structure, so it's McLean's which really matters. Harvard is good branding, but I think it doesn't matter. So I think it's important to understand that really the people who are running this whole program is other people who are on the front line. I think a couple of steps from here. One is, as far as the Rajasthan Royals is concerned, we believe in empowerment. And I think what this exhibition does is knowledge, and knowledge is empowering. And I think this empowerment, if given to women and to children first, is much better than giving it to men, because men are careless with knowledge. So I think it's very important that we sort of get this knowledge going to women and empowering women to help us to make a better world for tomorrow. So I think that would be the first thing that I would do, and I'd like to offer to take it obviously to Rajasthan, which is the capital of our first royal, Shane Warne. He was the winning captain, and it really matters, but when I told him yesterday, the thing is that Shane Warne never says no to good causes. So it is really, we've delayed his time. He's got a meeting at 3 o'clock in ITC. We've sent a message, but he still says this cause is really good. So to have brand ambassadors like this is incredible. To Praveen Pardeshi, who is a compatriot in a way because we studied in the same school. He was, of course, much junior. Or does he look much older than me? I'm not sure. But nevertheless, we were in the same school. And he, at any point, I tell him anything that I say he thinks is a good cause, which is not true. And anything I invite him for, he always comes. He makes adjustments because he's not his total boss. He's a boss, but not full boss. So I think he basically sort of turns up at these functions and just puts the hand around me and says that, Ranjit, what you're doing is good and it's fantastic. Whatever you need. So can you imagine a person in the Chief Minister's office, his phone rings all the time, his WhatsApp sort of goes ding ding all the time, and he's at all meetings, and the Chief Minister suddenly decides at 1 o'clock at night have a meeting at 8, 9. So his programs are still adhered to, and that's the reason we changed. So I cannot believe that I know a government officer who's so great. But that leads to the second thing. There's a public-private partnership where without government, we cannot do anything. Without government, there is no governance. And that governance is brought in by people like yourselves in the private sector, be it global or otherwise. And that knowledge and delivery through the government is absolutely prime, because that's where we don't reach. So available and affordable is absolutely critical with government partnerships. So that was the second point. And the third thing is we need all of you to be evangelists. And I think after this, Shane has been great, but the Nehru Science Center, how many people have come and learned. I don't think science sounds so complicated to me, I don't even understand mathematics, or subjects like that. But I think what this helps you to do is touch and feel that there is so much unknown. And the fact that something is unknown, like science, is something that helps us to go and touch and feel and at least approach people who know. So I think this approachability, is a very important criteria of institutions which actually help to spread knowledge. So with that, I don't want to take more of your time and more importantly of Sir Shane Warne's time. So thank you so much, all of you, Praveen, Shane,